and if I can take you through some important changes, some common sense, sensible changes in response to the new variant. Victoria is in one of the strongest positions really of any place around the world to combat this new fast-paced variant. And that's because Victorians went out and got vaccinated in record numbers. Because Victorians went out and got vaccinated in record numbers, it means that we are not considering going into lockdown. And this is the commitment that we gave to the people of Victoria. The promise was, if you go and get vaccinated, then you can enjoy Christmas and New Year with your families and your loved ones, and that's exactly what will happen. That said, we still need to be smart, we still need to protect ourselves and our loved ones from getting sick, and also ensure our healthcare workers are not being overwhelmed. To that end, vaccination has always been our pathway through this pandemic, and it still is. And that's why we want to get as many Victorians protected as quickly as we possibly can. As part of the plan to combat Omicron, today I'm announcing that we are investing in a major boost to support the third dose rollout, including more than $31 million to support the Commonwealth's program while we await ATAGI advice on dose intervals. And again, I want to be really clear. The interval needs to be shortened, and the interval needs to be shortened immediately. That's the view of Victoria, that's the view of New South Wales, that's the view of jurisdictions across the country. It is the clear public health advice that we're getting. The interval needs to be shortened, and it needs to be shortened immediately. But what we're announcing today is that we're ready to scale up to meet that demand. So this new investment will enable a massive scale up to support a major expansion of our state-run vaccination centres. I was at the Royal Exhibition Building just this morning receiving my third dose. And it will also go to a rapid recruitment and training of new workers that will be required to deliver on this. This investment will mean that if the Commonwealth can meet the doses that they have projected, up to 900,000 doses can be delivered every week in Victoria. We know Victorians will continue to do what they've done every day throughout this pandemic, act sensibly to slow the spread of the virus to their friends, their family and the community. Today we're also announcing some modest and common sense changes to settings as an appropriate response to this fast-moving variant. With the emergence of Omicron and significant case numbers, particularly in New South Wales and Victoria, the Minister for Health, on advice of the Chief Health Officer, has recommended additional measures to slow the spread and to keep Victoria open. So what that means, from 11:59 p.m. tonight, the following additional measures will apply in Victoria. Face masks will be required in all indoor settings except private homes for persons 8 and over. And as a parent and an education minister, our kids are used to this. Grade 3, 4, 5, 6 students have been wearing a mask at school throughout term 4. They're used to wearing masks. Again, this makes common sense. Face masks will also be required at all major events over 30,000 people. So again, to be clear, face masks will be required indoors and outdoors when moving around, although masks can be removed when seated outdoors. Again, common sense. This is a sensible response which will allow businesses to stay open, bars and restaurants to continue to serve customers, and major events to go ahead. Masks are a cheap and effective way to maintain the health of the community, and it's something that public health experts have been calling for. We're also going to be recommending Victorians, take advantage of the festive season and work from home. A lot of people are already doing this through the Christmas, New Year period. Again, it makes common sense. Ultimately, we're able to keep our state open because more than 90% of Victorians got vaccinated, and we're vaccinating our way through this variant as well. So my final message is, if you are eligible for your third dose, make a booking and get it done. If you are not yet double dosed, make sure you get your second dose. Indeed, if you haven't got your first one, please get it done. This is not a booster program. As I said a couple of days ago, boosters give a connotation of it's an optional, nice to have. It is not. The third dose is critical in our fight against this new variant, and we've got this window of opportunity. We're seeing what's happening in the Northern Hemisphere in the colder months. Through this summer period, getting the third dose is so critical to combating, and we've got to take up that opportunity. I'll now hand over to Minister Foley, who will take us through a bit more detail on the third dose program and also the change in settings, and then we'll hear from Professor Sutton. Martin.
Thanks, Acting Premier. So, as James has indicated, Victoria is in a really strong position by any measure worldwide. And we're in a strong position to deal with this fast-moving new variant to protect ourselves, to protect our health system, and to enjoy the coming festive and holiday season because we are so well vaccinated. And we acknowledge that Victorians have done so much to go out and get vaccinated in such strong numbers. And we've delivered on our part of the national plan for reopening. But a new variant of concern has arisen globally, and we need to take measures to protect our community from that rapidly spreading variant, whilst our health experts, both here, both interstate and globally, understand what it means for our community going into 2022. That's why the measures that the Acting Premier has referred to are being rolled out today. But in addition to those masks, there are two recommendations, not orders, but two common sense measures that we think Victorians need to have in place for the festive season. As the Acting Premier has talked about, one is the recommendation to take advantage of the festive season to work from home, and the second is a recommendation to hospitality venues to take steps where they can to stick to seated service rather than to have people moving around crowded venues, and for people to save their dance moves for dance floors in well-ventilated outdoor areas. As the Acting Premier has mentioned, we are increasing our support for the third dose rollout program by bringing in changes which make it mandatory to wear masks inside, in non-domestic settings, inside if you are 8 years or older. We encourage all Victorians to take advantage of the festive season and to do so safely. We think all of these measures are simple and common sense, sensible settings that keep us open and ensure that everyone celebrates this coming period safely with their families whilst managing as best we can the challenges of this new variant of concern. Masks will help keep businesses open and they massively reduce the risks of transmission. The modelling that the Commonwealth received from AHPPC tells us that the risks of not acting far outweigh the risks of acting. So the modelling also tells us that people wearing masks will significantly reduce the pressure on our hospitals and keep people safe. That's why the government is also making third doses available to aged care residents, with every Victorian public aged care facility set to have completed their booster program by Christmas Day. I'm also very pleased to advise that 28 more pop-up vaccination sites will open over the coming weeks, and the current fixed sites, over 50 of them, will expand to operate 12 hours a day, 7 days a week. The site at the Royal Exhibition Buildings will stay open as our iconic flagship site well into late March 2022. To help increase vaccination capacity, temporary sites will also be set up in locations such as High Point, Pacific Werribee, Eastland, Water Gardens and the Emporium, so people can get their third dose whilst they're doing their shopping. Can I give a big thank you to the Shopping Centre Council of Australia, who have stood up and helped us with these sites in shopping centres. The sites at both Water Gardens and Emporium are opening today and will make it easier for people to get their jabs whilst Christmas shopping. More sites will be opening, and we're urging all Victorians who are eligible for that third dose to book their appointment as soon as possible, and particularly in those areas where you're at a higher risk of contracting the virus, aged care, healthcare workers, etc. Ensuring kids are protected from coronavirus is also front and centre for our activities moving into 2022. And we want to continue to reinforce that the 5 to 11-year-old program is locked in and is the bedrock of our activities heading into 2022 January. So parents are encouraged to get their kids vaccinated and to roll out the 5 to 11-year-old vaccination program, which begins on the 10th of January. Parents and families can be confident that the scale up of the booster program will not delay their kids' protection through that program, and that the paediatric vaccine appointments will be ring-fenced and protected so as to make sure that whether it's to the state clinics or the GPs or the pharmacies, those 570,000 kids in that age bracket are locked in for their support for their vaccines over January. These are all changes which will help protect the most vulnerable people in our community whilst Victorians go and get their third dose. We're doing this work now, so we are in the best position possible to respond to the challenges that Omicron has bowled up to us. We're doing this now so that people can enjoy a safe and happy Christmas and a New Year period, and to put us in the best possible position to get ahead of what is going to be a significant set of challenges, as we've seen in New South Wales and with increasing cases in both New South Wales and Victoria. I'll now hand over to Professor Sutton, who will provide us a little bit more detail about the booster program and mask usage. Thank you.
Thanks, Minister. Firstly, it's absolutely fantastic to see how many Victorians are coming forward for their third dose, as I did yesterday at a pop-up site. My thanks to the team there, you know who you are. A little bit of a headache today, a bit of a sore right arm, but that's an immune system doing exactly what it should do. The great majority of people will get that kind of localised and mild response, which is a great sign of increased protection. We're reporting over 16,000 doses delivered through state-run centres yesterday. That's double what it was a week ago, and a week ago is double what it was the week before that. So it's really ramping up, which is fantastic. We also hit another milestone today, 5 million vaccine doses delivered through state hubs and health services. Again, a huge effort, one of the biggest in Australia, if not the biggest. And as the Acting Premier said, we have built one of the most vaccinated societies on earth. That puts us in just a fantastic position, a wall of immunity to meet this challenge of Omicron, and it means that we can go ahead with much more confidence than many other places in the world that will have some trepidation with the big numbers that Omicron might bring. I know Victorians are concerned about what summer might have ahead, but again, our current vaccination rates are a very important measure of our individual and collective protection. We know that 2 doses provide good protection against severe illness, against hospitalisation, against ending up in ICU. That booster dose, and the evidence is increasing day by day, even greater protection against severe illness and hospitalisation. So I urge anyone who's eligible right now to do what my family has done and get that third dose. Also looking forward to, obviously, my kids getting their dose in January. Can't come soon enough. But there's still a lot of uncertainty about Omicron. There is some suggestion, and it's good news, that it might be less virulent, maybe a fifth as virulent as the Delta variant. But the numbers are big with Omicron. You know, New South Wales has got 15 times the number that they had just a couple of weeks ago. So a fifth as severe, but 15 times as many cases is going to be a challenge to a health system. So we need to do everything we can, boosters being at the backbone of that. But we need to be aware that significant case numbers still represent a risk to us So we need to do everything we can to work on that. But the booster dose, the third dose, as I think we should call it, is really encouraging in terms of the additional protection against severe illness. More than 430,000 Victorians have had a third dose so far, and our partners in our GPs and our pharmacists can apply for grants up to $15,000 to help them vaccinate their communities. So go wherever you can. This is a collective effort. As the Minister said, there's a lot of stepping up in terms of being able to provide more third doses through coming weeks, but we need people to get in those queues and get that third dose. Other measures that we've talked about, masks, they're a very small individual cost for us. They have a terrific impact on transmission, and that's as true for Omicron as for any variant. So please bear that in mind. Mandating wearing of masks indoors, with the usual exceptions, is really critical. And to wear them outdoors when you're moving around at big events, also important. So terrific to see already increased mask use across the community. And there is a difference in a mandate versus a strong recommendation. I remember seeing all of you last time I was here, and I don't think there were masks on. Everyone's wearing a mask today, you know, with an impending mandate. So it makes a difference in terms of how many people are wearing it. Great to see QR codes still picking up people and prompting them to get tested and isolate until they get a result. We'll be ramping up our rapid antigen testing for large numbers, and again, our booster program will really accelerate. Working from home, if you can, another important recommendation, and we have provided additional advice, and I've made a video recently about the importance of ventilation. Meeting outdoors, critically important. If you can, please do. If you can open doors and windows wherever possible, if you are meeting indoors, please do. I'll be doing a little round for Christmas to open doors and windows whenever I'm inside. Finally, I understand people are concerned about Omicron. A lot that remains uncertain, but as we've said, we're in a fantastic position. These modest measures will put us in an even better position and can literally bend that curve so that we don't have to face an already challenged health system, and we can protect the entire Victorian community and give our healthcare workers some assurance that they're not going to face a really difficult couple of months ahead. Thank you.
Sorry, while you're there, our intensive care numbers are down, our numbers on ventilators are down. You just said Omicron is a fifth as dangerous as Delta in terms of its virulence. Why do we have to force people to do anything? ICU numbers are up. Not over the past week. So ICU numbers always lag cases. Our ICU numbers have remained relatively stable over the last couple of weeks, a slow creep up as the Minister's indicated. They reflect numbers in the previous weeks, the case numbers in the previous weeks. They've been creeping up slowly. If we face big numbers with Omicron, we can expect more cases in hospital and more cases in ICU. We shouldn't look at the numbers in ICU today and think that that's a reflection of Omicron cases. At the moment, our case numbers are mostly still driven by the Delta variant, and the Omicron numbers are relatively low in Victoria. They will increase very significantly, even with these measures, in coming weeks, and it will be a challenge. I'm not sure if it's a fifth as severe. Early indications out of the National Institute of Communicable Diseases in South Africa, a good study, and it's a really robust research institute, suggests that hospitalisation might be significantly down for the Omicron variant. But again, if you see thousands upon thousands of cases, that will absolutely challenge our hospitals and our ICU. And so these are absolutely appropriate, modest measures. Why don't you just highly recommend something?
So the difference between highly recommending something and mandating something is the level of compliance that we see. I've just pointed out to you the masks that we saw come off as soon as we went from mandate to strongly recommended. We usually get about 50% levels of cooperation or compliance with a strong recommendation. It goes to 95, 99% with a mandate. Why would you introduce a half measure when you need the full measure to be in place?
What do you think about
I've provided my advice to the Minister. I've been very clear about how I see the epidemiology and all of the recommendations that I've made. I'd encourage you to have a look at that advice when it's published. But I'm happy that we're making all of these measures, and I know that they'll work in synergy. It's not a single thing in isolation. We are not just riding on boosters. All of these measures together will make a big difference. Sorry?
Did you recommend capacity caps at all?
Sorry?
Did you recommend capacity caps?
So the individual public events framework will look at individual events going forward, but the measures for upcoming events will settle as they arise, essentially. Sorry, Samaya?
Just on that, like other hospitality venues, did you recommend capacity caps for other venues?
So my recommendations to the Minister can speak to the orders that are being made, but my recommendations have all been provided and have detailed the things that I want the Minister to consider. And as you know, in the pandemic legislation, I lay that out in terms of things for consideration. The Minister takes account of those recommendations or considerations and all other factors.
Did the Minister accept all of your recommendations?
I'll let the Minister speak to the advice that he received and how he's going forward with orders.
As a health professional, advice for third doses. As a health professional, you've looked at all the information you have available to you and you've decided that masks are the best move for us to mandate them. Does it then somewhat become frustrating that you see the Prime Minister stand up and say they're only highly recommended?
Look, they are highly recommended, but a mandate is something that AHPPC were very clear on. So all of the Chief Health Officers across the country know what a mandate means in terms of introducing an immediate social norm, kind of social permission, if you like, and we see people responding to that. That's not to say that there isn't personal responsibility in this space, but there is a collective responsibility, and we know that a mandate makes a difference in that regard. That's why it's my recommendation.
The ATARCI advice on third doses is to have it after 5 months. As the acting Premier said, Victoria's position is to receive it after the 4th month. I guess, why is that your position and why does it necessarily differ from ATARCI's?
Look, there are a significant number of people who are yet to get their booster, so we need them to step forward and receive it. But with a significant challenge of big numbers of Omicron coming, having especially people with pre-existing illness, those over 70, those in aged care, who are at the 4-month mark, and we know from studies will have a vulnerability to severe illness. I want to see them get protected right now because they will be facing significant risk of exposure in a very short period of time.
One of the things Professor Cheng said, I think it might have been last week regarding the booster intervals, is I guess the need for the to play the long game as well. What's the difference between getting a booster at 4 months versus 5 months in terms of the longer game?
We can't say with absolute certainty, and that's why this is not an easy space to provide advice in or to land a position. But we need to respond to what's in front of us right now as an immediate and urgent concern. That's my view. And I know that people are at risk without the booster dose, and I want to see them, especially those most at risk, to have access to that booster.
You say you'll respond, but haven't we already responded by getting double vaccinated? I know that the booster is critical, but when you say you can't be sure what the difference is between 4 and 5 months, how can the acting Premier, presumably on your advice, come out and say we want to see it faster if you can't say for certain what the difference is?
Well, we can say for certain that people who haven't received the booster dose are at greater risk of hospitalisation, of dying and of going to ICU.
But the difference between 4 months and 5 months?
So the difference between 4 and 5 months at the moment is who is eligible to get it right now as we face very large numbers of Omicron. And so having those individuals eligible and receiving that booster will protect them. We need as many people in that category already boosted as we possibly can, especially those at risk of dying.
What studies or science backs up that position that it should be an interval of 4 months as opposed to 5?
So the evidence is pretty clear that the booster dose provides greater protection from hospitalisation, from ICU and from dying. I think that speaks for itself.
Alan wrote last week that if you wait longer, you get better immunity, you get a better immune response. And even just say, for example, in the last week or so when we've seen people speak about how Moderna may be a better option than Pfizer for a booster, if people had rushed to get that, they might not have heard that advice. So why...
So we've got an immediate challenge. We've got thousands upon thousands of people who've had 2 doses, who are not yet boosted, who we know are at still at significant risk if they've got pre-existing conditions, if they're very elderly, without that booster. And so we can't just think about, how might things look in July of next year. We need to think about what the immediate challenge is for those individuals who are not sufficiently protected until they've got that booster.
And do you think to be considered fully vaccinated it should be 3 doses instead of the current 2? Because WA's obviously mandated it now.
Look, I think the evidence is moving very strongly in that direction, that, it might be semantics, but I don't think anyone is arguing with the fact that the booster provides a very substantial additional protection.
And do you see Victoria moving to what Western Australia has done in terms of mandating?
Oh, look, I've got no advice on that at the moment. I think people are super keen to get the booster. We need to make it available. We need to ensure that appropriate numbers are eligible, and then see how that booster coverage goes.
And there was a big drive, I guess, by the time we went from I think it was 50 or 60% to 90% very, very quickly. The mandates were a part of that. Getting out of lockdowns was a part of that. I think Jerome yesterday said there were still hundreds of thousands of people who are eligible for the booster now not getting it. How do we drive up those current cases as well and make sure that we've boosted everyone who's eligible?
Well, I think that's happening. I think that's about to happen in big numbers, and that's what standing up here today is about as well. It'll be slow over the next week. People have other things on their mind. In the new year, I expect tens of thousands of people to come forward for their booster with an understanding of exactly what it means for them and protecting their families through the new year.
Are you disappointed ATAGI hasn't fast-tracked the booster shots?
No, look, we will continue to engage with ATAGI, HPPC, provide a population health, public health input to their considerations. They need to look at all of the technical evidence around safety and efficacy. They've got specific advice that kind of relates to the individual who's getting the booster. We want to provide that population health input as well, what it means when you're faced with tens of thousands of cases and a significantly greater risk of exposure.
Can I just double check the rules for standing up and drinking at the bar or...
Can I just ask one more on booster shots?
Just on booster shots?
I'm sure the Minister can...
So,
Standing up and drinking at bars or at nightclubs that aren't well ventilated?
so the recommendation is that if you want to be as safe as you can, not to do that, but it won't be an order. There's so many events already planned, New Year's, Christmas, etc., that in regards to what's proportionate and what's appropriate, I took the view that it was most appropriate to keep those locked in. Now, having said that, circumstances might well change, but those events, certainly, these orders run till the 12th of January, so these are the orders in place until
So
then.
masks in offices, for example.
I beg pardon?
Masks in office spaces, like if you're an office worker, you're required to wear a mask. Masks if you're just outdoors walking around the street.
No. So non-domestic settings, masks are now, well, as of 11:59 p.m. tonight, masks are required under the orders. So if you're outside and provide with the normal arrangements. If you can't safely socially distance, then you should always keep the options of masks, and we're seeing that happen increasingly. But in terms of what you're obliged to do, if you've got a roof over your head, work, and provided it's not your home, work on the basis in a non-domestic setting that you should be wearing a mask. There are, of course, exceptions to that, as there normally are with people who have medical conditions and the other range of exemptions that we've factored into the system over the course of the last 18 months, 2 years.
It's also wedding season now as well. Does
Yes.
the bride and the groom, for example, have to wear a mask?
As we've done in the past, whether it's photos or whether it's wedding dances, there's always those sensible, common sense exceptions to those special events.
But just to clarify, so masks aren't required at big household Christmas parties?
A big pardon?
Are masks not required at big household Christmas parties and with numerous families gathering?
So if you're at a domestic setting, no. But if you're at a party, at a hospitality venue, we're asking people just to think about keeping safe in different ways and those venue operators to do their part to help people keep safe in different ways. But it's not an obligation.
The Victorian Chamber says it would have preferred mask wearing to remain an individual choice and would like to see the requirement removed before office workers return early in the new year. Did the government consider at all excluding office workers from this decision, and how long do you expect it to be in place?
Well, as I indicated, these orders are in place till the 12th of January, and my message is that what this package is doing today is delivering on the very advice that was forwarded to the Prime Minister as the Chair of National Cabinet from his own Premier Health Advisory Group, AHPPC, last Friday, which he was kind enough to share with jurisdictions over the weekend. That group called for precisely this measure. That group called for masks to be mandatory as a low-cost, high-value intervention to deal with the challenges of Omicron, whilst we all figure out exactly what it means in an Australian context. And as we've seen in New South Wales, we've seen a rapid escalation. At the moment, we haven't seen that yet in Victoria or other jurisdictions, but that variant does not know if it's in New South Wales or Victoria, and we would be foolish not to work on the basis that we will see a similar escalation of Omicron cases in this state. So taking these measures, getting ahead of a booster program that can be supercharged, as I think the Chief Medical Officer for the Commonwealth referred to in recent days, we're up for that. And we think that the measures that AHPPC sensibly recommended to the Prime Minister and that were then shared with all the states at National Cabinet, we think they are the measures that we should all enact.
Is New South Wales doing the wrong thing, not mandating masks at all?
The start here. What was that?
Given that the Prime Minister received the same advice you did and said that masks should be highly recommended, and that New South Wales, which actually has an Omicron outbreak, an extreme Omicron outbreak, will likely not mandate masks?
I think you're, with gross respect, you got one element wrong. If you check the AHPPC advice, it says that these should be mandated.
I understand that, but I'm saying despite receiving that advice, the Prime Minister said he believes they should be highly recommended. Dom Perrottet has said we should treat New South Wales adults like adults. So why will it remain highly recommended there, but mandatory here under your order?
And in South Australia, and in Queensland, and in the ACT, and in Tasmania. So we are acting in what we think is an appropriate expression of leadership based on the public health advice. What the Prime Minister does is a matter for the Prime Minister.
Is New South Wales doing the wrong thing by not mandating masks indoors?
When they made that decision, they made it in a very different context. That was in a Delta world. I have no criticisms of the New South Wales government's approach. We all make the decisions based on the circumstances that we face. We want to make sure, as Brett indicated, that some of the modelling that has been predicted to AHPPC by the Doherty, which was shared, there's different aspects of how we can flatten that curve, to go back to early 2020. We have an opportunity to flatten that curve, and these sensible, common sense measures that take the opportunity of mandating masks and having the support for a ramped up booster program that sees paediatric vaccines rolled out from the 10th of January and that sees a couple of other common sense recommendations. We think that combination, as recommended by AHPPC, will allow us to flatten that curve.
Given New South Wales and Victoria are staying open to each other, the two biggest economies, do you think it would be more wise to have the same restrictions across both states?
We work closely with New South Wales and we always seek to align measures, and we will continue to do so. I know that our public health officials, I know at a ministerial level, I know at a Premier level, we are working increasingly closely with New South Wales, and we'll continue to try to align wherever we possibly can. And I'm confident that as we head into 2022, you'll see more of that, not less.
New South Wales is also considering ordering in bulk rapid antigen. New South Wales is also considering ordering in bulk rapid antigen tests and distributing it freely across the state. Is this something that Victoria would consider as well?
Look, we'll have a look at all sorts of measures as to how we can appropriately nuance our test, trace and isolate and quarantine system in face of the changes that we would expect to see. The PCR test is the rolled gold model, but increasingly rapid antigen testing is highly accurate and highly effective. We need to protect our PCR testing system in the face of what we'd expect to be increased demand and protect it from, as my New South Wales colleague called it, tourism testing. We need to have it for people with cases, people who are household contacts, and what it was designed for. If that means we need to do different things with rapid antigen testing, we're having a very close look at that.
So is it time for, I guess, places like Queensland, South Australia, I think Tasmania as well, to drop their, I guess, PCR requirements, given a quarter of our tests are for those, tourism tests?
Well, if they're matters for those other jurisdictions, it's not my role to be critical of other states. I understand why they have those measures in place. All we'd ask them is to just have a think about what's the proportionate risk management now, as we are seeing all states that are opening up to each other just creep up those cases. The projections that we've seen from the Doherty that went to the Prime Minister and AHPPC and to National Cabinet show that those measures are going to have an impact, but there are issues of the two big states having to shift resources to essentially assist other states.
Sorry, can you confirm how many cases of Omicron are currently in hospital?
Well, as we know that hospitalisations and particularly severe cases of hospitalisations tend to lag between 2 to 3 weeks after cases first become infectious. So nearly all of our cases in hospital at the moment are Delta variant cases. So we would expect, I hope I'm wrong, but if we do see cases from the Omicron variant start to emerge, we would expect that that will start to show up in our healthcare system probably in another week or two.
At the moment it's 0?
I don't know exactly how many it is. The arrangements that we have in place identify people through the S-gene dropout arrangement. We're seeing an increasing number of Omicron cases. At the moment, it's not near the level of our friends in New South Wales, but we're on a path, and that's why these measures that we've announced today are designed to divert us from the more extreme projections that we saw in the Doherty modelling and act in accordance with the AHPPC advice and act in accordance with the advice that we've received to make sure that we stay open and that we stay safe and that Victorians, having worked so hard, enjoy the Christmas and New Year and the holiday period that they've rightly come to expect. And these sensible, proportionate and necessary measures will help us achieve that.
So given we haven't seen that modelling, what are we preventing?
Well, we have seen the modelling. AHPPC has released it. Well, it's been widely reported.
Can you explain to us what we're preventing, what you believe you're preventing with these measures?
I'd refer you to the Doherty modelling, which shows quite high rates of infectivity together with high rates of hospitalisation and high rates of ICU. That's the Prime Minister's modelling. He sent it to all the states. He had it referred to, it's been referred to in quite a number of newspapers and media reports over the course of this week, and I'd simply refer you to that very modelling. It's not mine, it's the Prime Minister's.
Can you explain Professor Sutton's entire advice to you?
So, as you're now aware, every word of Professor Sutton's advice to me under the new pandemic provision orders is made available, made public. It's tabled in the Parliament and it's tabled online. I think my first set of advice and response to that from last week has been put up online. These orders will also be put up in line. My reasons for those and Professor Sutton's advice to me will also be put up online.
Did you accept all of the Chief Health Officer's recommendations?
So the legislation clearly envisages a process that has the following steps. I seek advice. The Chief Health Officer provides the advice on those areas. I then take into, as the foundation of that, the public health measures around that advice. But I do have the obligation to seek wider views, be they economic, social, cultural, mental health, etc., to take all those into account, and that's precisely what I've done.
Last question.
What's that?
So did you take all restrictions?
I took all of Professor Sutton's advice into account, as I'm obliged to. I also took into account the impacts on the Human Rights Charter, which I'm obliged to, and I've arrived at what I consider to be a measured, necessary and appropriate and proportionate set of outcomes, which I'm in the process of signing off so as to take effect of 11:59 p.m. tonight.
Did the Chief Health Officer encourage tighter restrictions?
A big pun?
Did the Chief Health Officer encourage tighter restrictions?
When I release the Chief Health Officer's advice, you'll see that I've acted overwhelmingly in accordance with Brett's advice, as I always have.
Are density quotients being considered, and do you envision crowd caps at the Australian Open?
No, density quotients aren't being considered as part of these arrangements that we're announcing today. In terms of the Australian Open, as the Acting Premier indicated earlier, we've got no plans for those. What we want to do is, as we've learnt more about how we respond to the ever-evolving global pandemic, what measures can we put in place to keep those venues safe? We've worked closely with the MCG, we're working closely with the Australian Open, and those venues want to make sure that they stay open. They want to make sure that they protect their players, their staff, the people who attend, and so do we, and we'll continue to work with those. As Brett indicated, we've released a public events framework for all events over 30,000. That's out there in the real world. We're working with all of the people who provide those events to keep them safe and to make sure that as we go about enjoying as close to a normal summer as we can, that we have those measures that keep those events happening and people at them safe.
And just on that then, will density quotient,
We'll go like this.
then will density quotients, is that something that's in consideration or something that you'll look at sort of moving forward to have, as an open economy as possible without, really severe restrictions, but density perhaps in some locations?
So that's why we're taking these measures now, so as to avoid more severe measures that the Doherty modelling pointed to if you don't take these measures now. So these are preemptive moves to make sure sensible, common sense, proportionate moves that allow us to stay open and the kind of events, yes, with a bit of tweaking, can continue on. We're here to avoid the lockdowns. We're here to avoid the measures that happened in a non-vaccinated world. That's why
global market, but that's where we are. So right now, we're purchasing as much as we can because there's an agreement at National Cabinet that at the next National Cabinet, there will be some advice about what changes may happen in terms of testing and quarantine and isolation arrangements. So as the Minister indicated and Professor Sutton, we want to focus the PCR testing on those that most need it. Symptomatic, positive cases, very close contacts. For others, I think the world is moving towards utilising rapid antigen testing. So there'll be advice coming to the next National Cabinet on test and isolation arrangements, getting some consistency and definitions across the country. In the lead up to that, we're purchasing as much as we can. It would be ideal if there was federal government responsibility and contribution towards the purchasing of those rapid antigen tests.
Have you had any people travelling interstate for New Year? That rule is unlikely to change given the next National Cabinet is in 2 weeks' time, if I'm correct.
Yeah, as Martin indicated, the arrangements in terms of testing requirements are matters for other jurisdictions. For Victorians that are travelling interstate, we can't control that, and they're matters that those jurisdictions are taking. We don't have those requirements, but we are working towards, and I think the world's moving towards an environment where rapid antigen testing will become a significant part of how we combat and manage the pandemic.
Have you had any frank discussions with the Queensland Premier about just how much that demand for interstate testing is choking up our testing systems?
Well, that was discussed at National Cabinet. You know, it is having an impact. There's no doubt about that. It's something in the order of a quarter of our testing are for people who are preparing to holiday interstate. So it is having an impact. That's not ideal, but again, that's not something that we can control from Victoria. These are decisions that other jurisdictions have made.
James, how much will people who don't wear a mask be fined?
In terms of the fine arrangements,
it'll vary, but the easiest way is to wear a mask and not be fined, but it can be up to 500 up to over $1,000.
Yeah, so 500 up to 1,000. So those arrangements haven't changed.
So can you just repeat it from the start and explain who gets a $500 fine, who gets a $1,000 fine for not wearing a mask?
I might pass over to the Minister for Health to take you through those details.
So you would have seen as part of the pandemic legislation that went through late this year, that we put in place a new system of managing fines, whether it be through authorised officers or Victoria Police. These decisions as to fines, whether they're applied, they vary depending on the circumstances and the judgments made by authorised officers of Victoria Police, but they can vary from a few $100s up to over $1,000 if it's considered to be a particularly unhelpful approach to these things. It will depend on the circumstances, but the easiest way to deal with that, of course, is not to get fined, and that is to wear a mask.
Sorry, then can you just confirm what's the absolute minimum that you will be fined if you refuse to wear a mask?
The absolute dollar figure I can get to you, but it was as amended in the most recent legislation, and I'll get that figure to you.
And who would get the more expensive fine?
Those who willfully and deliberately evade or don't abide by the directions of whether it be authorised officers or Victoria Police.
South Australia has delayed the start of its vaccine rollout for 5 to 11-year-olds due to distribution concerns. Are you confident that Victoria will have enough supply of the Pfizer vaccine for both expansion of the booster program and to vaccinate 5 to 11-year-olds?
Well, that's a matter for the Commonwealth, but we've received numerous confirmations that there is no problems with vaccine supply, whether it be the Pediatric vaccine or whether it be the adult third jabs. But that's a question you'd have to ask the Commonwealth.
But supply issues aside, it's going to be a big demand on the workforce if you have those two things coinciding together. It might be more of an issue of manpower. Do you foresee early next year that when we're rolling out those jabs for young children and ramping up the booster program that we'll run into any issues in Victoria?
So we've locked in terms of our workforce planning, the 5 to 11-year-old process. That's been in the system for some time now. It's a really good partnership between schools, the Department of Health, GPs and pharmacists. It's locked in. The only thing we need is the vaccine.
Are you
Can I
concerned
just
that
ask?
residents of more than 130 aged care homes won't have their boosters before Christmas? And what are you doing to try and speed up that process?
So we know that throughout the course of this pandemic, our aged care facilities have been really areas of concern. The dreadful winter of 2020, let alone we've seen across the nation outbreaks over the course of 2021. Vaccines we've seen over the course of 2021 have largely protected those aged care facilities. So we were very pleased that when it came to the third jab, that the Commonwealth rightly prioritised those areas. I'm very pleased that I've had confirmed that the state public sector residential aged care facilities will all be completed for their third jab before Christmas. There's just a few in the regions that our teams are tidying up. I was concerned to learn that a few days ago it was in the 200s, the number of private residential aged care facilities that had not been prioritised to be finished by Christmas. That figure has come down to, as I understand it, 136 yesterday. The Commonwealth have assured us that now, having given their provider a break until I think the 10th of January, and putting the program on hold, that they believe that that program can be resurrected again. We've asked for confirmation for that. We don't think our Victorians who are in private residential aged care facilities should wait that long. We've asked for confirmation, and I'm hopeful that that will be provided today. If it's not, we stand ready, willing and able to prioritise the support for those, I think, 136 residential aged care facilities.
Seriously, last question,
Just
guys.
to clarify, will Victorians turning up to Victorian vac hubs at their 4-month interval, will they be turned away? We're hearing reports that people are getting their third dose at 4 months.
Well, there are allowed exemptions under arrangements. If you're travelling, if you've got pre-existing case illness, if you're immunosuppressed, there's been a range of flexibilities built into the system. And indeed, the existing ATAGI advice, for when you read it through, actually is really a 4.5-month decision. It's not actually to the letter a 5-month decision between boosts. We think that the public health advice that's come from AHPPC, the public health advice that's come from our own public health teams, is that 4 months is most appropriate. And we look forward to ATAGI and the Commonwealth authorising that as soon as possible.
I'm so incredibly sorry, but Acting Premier, I just have one final question on borders, if that's okay.
Yeah.
I know it's been ruled out previously by the Premier, but do you sort of envisage any situation where we might have stricter border controls with some of the other states and territories?
No, I do not envisage any changes to our border arrangements. Again, it goes back to what I said at the start, the commitment we gave to the people of Victoria. Go and get vaccinated, and then you can enjoy Christmas and New Year with your family, friends and loved ones in Victoria and indeed right across our country.
So is this what living with COVID looks like?
Well, living with COVID looks like dealing with the challenge in front of us, and goes to the question about what are we avoiding. There's an immediate need that Professor Sutton took us through. You only have to look at other countries around the world in the Northern Hemisphere, look at the modelling. We are not through this pandemic, and at every step of the way we need to make common sense mitigations, restrictions, people indeed making personal decisions themselves to make sure that we can live as normal a life as we possibly can, and that's what we're enjoying. And that was the commitment we gave to the people of Victoria. Vaccines are our way through this, and the message very clearly today is that includes the third dose. And we've got a window of opportunity. These summer months is a massive opportunity for the people of Australia, for our kids to get vaccinated in January, for people to get their third dose immediately. This is our opportunity so we can avoid what's happening in Europe and in other parts of the world in their winter months. Thanks, everyone.
How about a shout out for our lone rider of Auslan? Done it all as a solo.
Good work. All right, thanks, everyone.